My name is Ashutosh Acharya. I'm a consultant orthopedic surgeon. I specialize in treatment of hip and knee condition and sports knee injuries. Today, I would like to talk to you about meniscal injuries, also sometimes known as cartilage injuries. Meniscal injuries occur in two different age groups. In very younger patients, it can happen with specific injury or significant knee injury, such as football injury or sports-related injuries. In these particular patients, when knee symptoms or pain starts after one good going specific injury, and if the patient has locking or jamming, then the patient may benefit by MRI scan of the knee. How does it present? Usually the patient will have pain either on the inside of the knee or on the outside of the knee. Patient may get some locking or jamming of the knee, or the knee may get caught in a position and it may take a while for the knee to straighten out. The patient may get swelling in the knee. Usually, when I obtain detailed history and examine the knee, one can come to a diagnosis of knee injury and meniscal injury. Patient may need MRI scan to confirm it. Depending on the findings of the scan, one can then decide about the treatment. Sometimes patient may benefit by trimming of the cartilage, but if the cartilage can be preserved and a repair can be carried out, it may be beneficial in long run because you are preserving your own cartilage. There is a different kind of meniscal tear seen in patients over the age of 40. Usually, patient may get sudden pain and swelling of the knee by simple twisting or turning either in the house or at work or by simple fall. When a patient does not have any significant knee injury and the pain and the swelling starts after a trivial twisting or pivoting, then in the patients over 40, we call it a degenerate meniscal tear. Usually, once again, the patient will have pain and swelling. On examination, the patient may have tenderness on inside of the knee or on the outside and may have slight fluid in the knee. Patients over 40 with no specific major injury may not need MRI scan to confirm meniscal tear. A plain simple radiograph might be all that is needed. These patients may benefit by one-off steroid injection in the knee, and this can relieve the pain in more than 50% of the patients, and patient may not need any operation. If the steroid injection does not give you lasting pain relief, if pain comes back again, then this patient may need further scan, further imaging, and operation if needed. The operation usually is performed through keyhole surgery. The patient has general anesthesia, and then we look inside the knee and trim the cartilage. The recovery is quite straightforward. Patient may not need to use the crutches. After 2 to 3 days, most of the pain should go away. Patient can take full weight on that leg after keyhole surgery. The risk and the complications are fairly minor. There is a very small risk of infection, bleeding, swelling, clot in the leg, clot breaking loose. We usually give injection to avoid clot in the leg. Patient may not need to use crutches, and by 2 to 3 weeks, the patient is almost back to normal self. It is a very good operation to have, provided you don't have any major arthritis in the knee. Most of the pain, the sharp stabbing pain on twisting, turning and jarring will go away, but some leg discomfort may persist if a patient has some wear and tear in the knee.